In this video, we will go over most of the possibilities as to why teeth become sensitive or painful after a root canal. I'm Rick Buck and I've been a dentist for 15 years, so like and subscribe if you have teeth. The main thing you want to know with pain after a root canal is, does the pain you have after the root canal feel different or the same as it did before the root canal? Here's why it is important. If your pain feels different than before, you are likely having a pain response to the inflammation from having your tooth worked on, though it could be other things that we'll go over in just a minute. We all know inflammation causes pain, and even though this is a small tooth, the inflammation can cause intense pain. So, inflammation after a root canal treatment is normal, and in fact, you can even expect at least a little bit of inflammation and thus at least a little bit of pain. How much inflammation and how much pain may be due to what caused it, but anywhere on the pain spectrum is normal after a root canal. But before we go on, first know this. No matter how bad this inflammation is, if it is actually inflammation, it will reside in time. Besides the normal inflammation from having your tooth worked on, there are 3 other main issues that could have caused the pain. The first thing that could have caused excessive inflammation and thus excessive pain after a root canal is what we call over-instrumentation. Basically, when dentists clean and shape the canals of your tooth, they normally use a series of files to clean it out and to shape it. And they're supposed to go right up to the tip of the root of your tooth, give or take about a millimeter or 2 shy or past the end of that tip. If they went past the tip too much, it will likely cause more pain after your root canal is done. But this isn't entirely bad because there is infection likely past that tip. And this makes a way for the medication that they use to kill all the bacteria to go a little bit past that tip and still kill a bunch of that bacteria too. But if that medication gets past that tip, or if they keep poking past that tip, yeah, you're more likely to have inflammation around the tooth. But once again, depending on how much they did it, it's not too bad of a thing to have happen. This brings me to the next cause of inflammation from a root canal, which is a medication that spreads too far. You see, for most people that are getting a root canal, they have a bunch of bacteria in the root canals of the teeth. And to kill the bacteria in and around the teeth during a root canal, the dentist will likely use something called sodium hypochlorite or bleach. What he'll do is put that sodium hypochlorite in a syringe and express it into the canals of the teeth, and it will spread throughout the tooth and kill all the infection. This bleach will go wherever the canals in your tooth lead it, and wherever the infection ate away at your bone and caused an abscess around your tooth as well. The problem is that the infection always spreads, and sometimes it spreads far into the bone and other spaces in your tissue, like maybe even your sinus. So because the sodium hypochlorite is simply just following the path of the infection, it can go into any of these tissues where the infection went as well. If the sodium hypochlorite spread too far, you likely even felt it a little bit during your appointment, and that's because it spread past to the point where you were numb. So in other words, if you're just numb in this area, and the sodium hypochlorite spread to this area, you are likely to have felt it during the procedure. Now, this isn't a great thing to feel during the procedure, and normally it will cause even more inflammation and possibly bruising after the root canal is done. The good thing is that it probably killed off a lot of that infection in the process. The bad side is you're likely going to have a lot of pain and maybe even be bruised and swollen from the spreading of that sodium hypochlorite too far. Okay, moving on from that, another cause of inflammation and pain from a root canal is that when the dentist fills your canals at the end of the procedure, some dentists use a hot, natural, rubbery substance that flows through the canals and settles and hardens and seals off the tooth from any future bacteria to get into it. Now, sometimes this material is too hot when they're using it, and it burns the tooth and the surrounding tissue, causing, once again, inflammation that can be very painful. But once again, as well, it will subside over the following days. If you have what we call post-operative pain and inflammation, ibuprofen normally works best as it takes down the inflammation as well as the pain response. If you're not able to take ibuprofen and it just doesn't work for you, a dentist can sometimes prescribe an anti-inflammatory instead of the ibuprofen. Or another option for some people is that they take omeprazole, or what you might know it as is Prilosec OTC, a little while before taking the ibuprofen because it will calm your stomach down so you don't get the bad stomach pain and effects of the ibuprofen. But all that being said, you don't have to take anything because the body will normally heal everything up in a few days anyway. But these medications are nice to have if you want pain relief and to reduce the inflammation in the meantime. Before I go on to other ways that the root canal may have triggered some pain mechanisms in your body, you need to watch my best daily brushing and flossing routine video. It will show you how to optimally take care of your teeth each and every day with all the best products that I have tested out in other videos that I've made. These products include my favorite floss, toothbrush, and toothpaste by far, but you can see why they are my favorite and the stunning results in a video that will pop up at the end screen of this video. Now, what we've covered this far is if the pain feels different than what you were feeling before. Now let's talk about if the pain that you're experiencing after the root canal is the same, or at least kind of the same as it was before doing the root canal. One of the possibilities for this may be that the tooth is cracked. You see, one of the hardest things to diagnose as a dentist is a cracked tooth. A lot of times a cracked tooth will be cracked in a way that can't be seen in the mouth or on an x-ray. But what makes things even more difficult as a dentist is that lots of teeth have cracks in them and they never cause any pain at all. And so sometimes we'll know a tooth is in pain, but we won't know that it's the crack that's causing the pain. And so fractures are kind of confusing in that small ones can be very intense, painful, or you can have big ones and they cause no pain at all. Then on top of that, the pain from a fractured tooth a lot of times will mimic other types of pain that you might be having in your teeth. A lot of dentists can pause on what to do with cracked teeth because for some people, a crack will stop cracking at a certain point. But this is impossible to predict how far a crack is going to go before it stops cracking. We as dentists call this cracked tooth syndrome. It is a good thing to know that in this case, most likely a root canal will help the tooth feel at least a little bit better. And for a lot of cracked teeth, this will be sufficient and the tooth will get better. Then, once there's a crown on the tooth, the crack will stop progressing and everything just works out. For others, however, that had a root canal due to a cracked tooth, the pain will only partially subside, or worse, it may still be the same kind of pain that they were having before the root canal was done. If you're one of the few rare people that this happens to, there's a difficult decision to make between you and the dentist. Do you need to extract the tooth or just leave it be for a while? When this does happen, that you're having pain similar to the pain before the root canal, and I'm fairly certain it's due to a crack in the tooth, I normally prescribe some anti-inflammatories and just try to give it a few weeks if possible and if the pain isn't too much. Then, at the end of those 2 weeks, we evaluate. Is the pain getting worse, staying the same, or subsiding? If the pain is minor and we think it will stay the same, we have to decide, is it livable, or would the patient rather have the tooth extracted? Now, let me put this into perspective for you. So I had one patient that we made this decision 10 years ago to keep the tooth instead of extract it. And I still see this patient at least once yearly at their cleanings. And to this day, they still would just rather keep the tooth than have it extracted. Now, they still have the slight pain once in a while, and it is more rare now than it was before, but it still does bother them a little bit. But the point is that a cracked tooth can cause problems and a root canal can fix it and make things better, but it also can leave things just the same, and then you have to decide whether you want to extract the tooth or whether you just want to kind of live with it, and if the pain or if the tooth is even livable in the first place. So moving on, another possible reason that the tooth is still in the same kind of pain is that the dentist didn't treat a canal in the tooth, and that canal still has a nerve in it. Let me further explain. Your tooth normally has 1 to 4 main canals in each tooth depending on which tooth it is. During a root canal, we can clean those canals out and fill them up. But first, when we do a root canal, a dentist has to find all of the canals. Now, sometimes those canals are so small that they are very hard to find, and sometimes are even calcified to a point that they are closed over and it's impossible to get into them. Basically what I'm saying is your canals constrict over time, and sometimes they'll constrict to the point where they're just completely closed over, at least at the top portion of it. Luckily, as dentists and root canal specialists, we know where each canal in each tooth is going to be, and we have a few tricks that we can use to find them most of the time. And we also know about how many roots and how many canals each tooth is gonna have. So we have a clue going into what we're gonna find. But now, knowing all of this, sometimes the dentist or even the endodontist missed a root canal, and there are a couple reasons for this. So if this happened to you and a main canal was missed, the root canal just needs to be completed at a follow-up appointment, and the dentist or the root canal specialist needs to find the canal and treat it. Now, if a main canal goes untreated and the nerve is still in it, this is easy to diagnose because the tooth will still have a pain or at least some type of response to putting heat or cold on the tooth. A root canal that was done completely will have no response whatsoever. But let me point something out. I've been using the term main canal because you see, those main canals will branch off into smaller accessory canals. A lot of times these accessory canals that branch off of the main canals are near impossible to treat. Luckily, most of the time to have a successful root canal, the only thing you need to treat are the main canals and everything will turn out just fine. What I'm trying to say is that if an accessory canal wasn't treated, the root canal normally still works just fine and there's no pain and no problem for the life of the tooth. In fact, the objective of a root canal is to mostly clean and shape and fill the main canals, and any accessory canals filled as just a bonus. However, once in a while, an accessory canal will cause pain or cause the root canal to fail. In this case, a root canal specialist will have to finish treating the tooth and fill the accessory canal. But an accessory canal causing pain after a root canal is an exception to the rule because most of the time they don't need to be treated like the main canal. Okay, let's go on to the next main reason you still might have pain once a root canal was completed. And this is one, as dentists, we hope doesn't ever happen, and in my 15 years hasn't happened to me yet. But the point is, you can incorrectly work on a tooth for good or for bad reasons, and still you would have pain afterwards. But I will tell you a story of a family member this happened to. If you watched all my videos on tooth pain, you may realize that tooth pain can actually be very tricky. I mean, we're talking some teeth can have referred pain from other teeth. Or some teeth can even have a phantom pain and the pain actually isn't in the tooth at all, but you feel the pain in the tooth. For example, you can have a phantom or referred pain from a muscle, yet it feels like actually a pain in the tooth. This is what happened. My family member insisted their pain was in a tooth. The dentist they were seeing wasn't sure that the pain was actually coming from the tooth, but they were an insistent family member and they were convinced their pain was in a specific tooth. Normally what you'd want to do as a patient, if you think you are right, you would go get a second opinion. But this family member didn't do that. So finally they persuaded their dentist to do a root canal on the tooth. And the dentist let them know that they weren't sure that this was what the tooth actually needed, but they were going to do it anyways. Well, of course, the dentist's gut reaction was correct. You see, years later, the problem never went away, and they had a root canal done twice on the tooth, once by a dentist and once by a root canal specialist. And they still felt pain in the tooth after both times the root canal was performed. One of the times, the pain seemed to have went away for a little bit, but came back. She then had the tooth extracted. That's when something very different and interesting happened. The same tooth oddly still felt pain after the extraction, even though the tooth wasn't even there anymore. So then it became obvious to most of the dental practitioners that this was some sort of phantom pain in the tooth. But then this family member had an implant placed in that spot where they lost the tooth. But then once again, they insisted the implant was causing pain in their mouth. And so once the crown was on, they wanted that crown taken off because they thought the crown on the implant was causing the pain. So the dentist humored them because they were insistent, and they took the crown off. Finally, we were able to convince them that it was phantom pain all along because the pain never even went away no matter what we did. So years later, we found out the pain was actually a referred pain from a muscle that when we treated that muscle with Botox, the pain in the tooth went away. This is relatively uncommon. We as dentists hope this is never the case, but it does happen from time to time with some dentists. Anyway, Remember, my favorite toothbrush, floss, and toothpaste and other dental products are linked to below this video. Everyone should watch my daily tooth care routine video I have posted now, and I will show you why in that video it is the best technique and products to brush and floss. If in Southern California, my dental office is linked to below this video. Like and subscribe if you have teeth. Phantom pain. That must stink.